Welcome back to Different Walk Serious Talks. You're back here with myself, Jessica, Sarah, Autumn, Markeisha, and we have a guest today, Jillian. Jillian's been a PA for 21 years. She's done family practice, urgent care, correctional medicine, emergency medicine, cosmetic dermatology. She's traveled throughout the U.S. as an Army wife. She's a proud mother of two, and she's very passionate about young people going into the medical fields and mentoring. So she's also passionate about African American women specifically having the tools and information that they need to take better care of themselves. Thank you for joining us, Jillian. If you'd like, you can go ahead and start us off. The topic for today is, why are women of color treated differently in the medical system? What are some resources, and have we personally been treated differently? And does the knowledge impact our choices when we're making medical decisions? Thanks for joining us, Jillian.
Thank you so much for inviting me here. A lot of times we have to we're confronted with this problem and have to look in towards ourselves to figure out what's going on and why. A lot of the statistics show that our Black females are 2 to 3 times more likely to die with a complication, and it shows 80% of that is usually preventable, and it's usually because we're dismissed or we are not looked at an early enough situation that we're just making this up. We're also more likely to have chronic diseases such as obesity, hypertension, and diabetes. And they relate to barriers to our care, like such as transportation or income, or just our socioeconomic environment. But they also show that when we have Black females and white females with similar backgrounds, we still are at a disadvantage and have more difficulty accessing care. Um, One of the issues is our representation in medicine, where there's a very small amount of Black female doctors. So a lot of times when you don't see your own trust and the relationship between your provider is not there, so you're less likely to and comfortable with that provider than if they look like you. And so as a Black female practitioner, it's always nice when I have a Black female patient that comes in and says, "Oh, I'm so glad to see you," because it makes you feel like you are, you can help your fellow sister.
That's a huge thing when you see people who look like you. I know I've specifically looked for people of color for my medical professionals because they understand differently. Even more recently, when I looked for a gyno, I looked for a Black female gyno, and I did try going to someone else, um, and I just went ahead and paid the fee out of pocket and was like, okay, let me just try it out. Um, and I tried the Black female doctor afterwards, and I was like, "Yep, that's who I'm going to." She she just fundamentally understands differently, and I relate to her differently. I was able to more comfortably tell her about the things that I wanted for my care. And it's like you said, it's very much very important, because if you're not giving all the details to your doctor, they can't give you good care.
Jillian, can I ask you, as a medical provider yourself, when you enter a space as a patient and you see someone that looks like you, do you still receive that same level of relief and reassurance? Or is it different for you because you know from the inside perspective how to navigate this?
I do see Black female or Black male doctor. Personally, I choose to have all African American doctors, or Black doctors rather. But when you talked about the point you felt the bias in the medical care, I have felt that personally myself, and I had to be my own advocate. And it came down to being female who said, "Okay," but everybody kept telling me, "No, you're fine, you're fine, you're fine, you're fine." And then that one Black female that I saw said, "Okay, let I will, allow us to go down this path that you think that we should go down." And then she found out I was correct. And she called and she apologized immensely to me. So even being a practitioner does not save you from bias.
What did it look like being your own advocate? What is something that you took away specifically that kind of helped get you where you needed to be? What kind of things should we be doing when we find ourselves in those situations?
For me, it was you don't stop until you get resolution. And I tell patients, I work in the ER, so I don't usually give patients resolution to their answers. And I tell them, I didn't give you resolution. And so you need to continue to go down your path. If that means you need to switch doctors, that's what you need to do. But you don't just let it stop ultimately wrong. And if your body is telling you that, then you need to keep screaming that to the mountains until you get your answers.
That's really good. That's really good. Thank you for that. And I'll say a little bit as well, like, I also work in the ER, not in a provider capacity, um, but I do ultrasound, so I see a lot of women that come in and they're telling me that they've had pain for years. And everybody keeps telling them they're okay. The labs are normal. We can't find anything. But they know that this isn't how they're supposed to live. Just hearing it is frustrating. So I can only imagine what it's like for them living it. And one thing that I often see is like pelvic congestion goes undiagnosed for so long, and it can have so many impacts on your health, on how you feel. And they're just living with this, not knowing that there is an answer and there's actually, like you said, a resolution. There is treatment available, but oftentimes it goes unnoticed. So it is very important for us to keep asking those questions and keep pushing, regardless of whatever resistance you might get, because nobody knows what you're going through quite like you do. So you have to be that voice. You have to advocate for yourself. And it's tiring, it's exhausting, and we shouldn't have to do it. And I feel like, especially for Black women, we get to experience that Black fatigue where we already are facing the resistance because we're dismissed outright because we're women. But then there is the racial bias and the other racial biases, and having to be strong or whatever, what have you. It all adds up. It's super exhausting. We shouldn't have to go through it. But if not us, then who? We have to speak up for ourselves.
And it's particularly important for us also to understand that we need to advocate for those in our circle as well. Sometimes
That's
they
good.
can't advocate for themselves. Sometimes they're just in so much pain, or they have so many issues, that and they have so much fatigue because of being sick for so long, that sometimes you have to pick up that mantle. It doesn't always translate well, especially if you don't know how to navigate that space already. I ended up being a caregiver for my mom when she got sick, and I was in my early 20s. I was maybe 22. I had no idea anything about the medical system. And my mom, she was too sick to really advocate for herself much of the time. And it took years and years and years to really find out what was going on. And much of her care was very much off the cuff. It wasn't anything that was a plan that was created for her. And they did tell her exactly what you're saying. It's all in your head. They diagnosed her with fibromyalgia before there were anything to really tell her what it is. Oh, it's fibromyalgia. It's something we can't do anything. There's no test. There's really that's your diagnosis. You're good. And then it's oh well, it's actually psychological. Like past your fibromyalgia, it's really just psychological. You're making yourself sick by thinking that you're sick. And then we went to an ER years into her care and going to the ER, and we're talking about ER several times a week. We go to an ER and they say, so what is your care plan for the brain tumor? And we're like, what? Uh, whose brain tumor? And they're like, I've looked at your records for years now. I looked at what has been here for years. It's nothing new. I just thought you knew because looking at historical data, it's always been here. And so things like that, we kept going. We kept trying to advocate for her. They removed her gallbladder because she had pain in her side. They ended up removing it because they waited so long that it was no longer able to be saved. And so, like, she told them, "I have pain in my side, I have pain in my side." And they kept saying, "Oh, well, there's nothing really wrong. We've looked, we've done colonoscopies, we've done endoscopies, we've done blood tests, nothing's really wrong with you." Until, "Oh, your gallbladder has sludge in it and it can't be saved." You're gonna have a operation to remove it next week. And so things like that, it's frustrating. They tell you that it's all in your head. There's really nothing wrong. There's nothing we can do for you. Go home and wait it out. Just take these pills. On a 6.25 an hour job, I was spending hundreds of dollars on medicine that she would take for a week until we get to the ER again. Uh, you know, and it was just so frustrating, and I know that people on this podcast have had similar things happen to them. You know, I know Farah specifically has had, like, her doctors have told her that, and you can share your own feelings about what that looked like. It's not just frustrating; it is demoralizing.
Mm,
So,
very true. Yeah.
Um,
I wasn't sure if you
so
were tearing up because of your own stuff or
just everybody, just so my most recent, I was pregnant. We found out sometime at the end of September. 'Cause my daughter told me. She says she leans on my stomach and she's like, "Mommy, my brother's something," and I kind of brushed it off, and I was like, "Sure, we're gonna have a little brother eventually, or a sister," joking with her. And she's like, "No, mommy, my little brother's on his way," and I'm like, and I take a pregnancy test and it was negative at the beginning of the weekend. But she's very adamant, my little girl. Through the whole weekend, she just starts talking about her brother this, her brother that. And by that Monday, I took another test and it was positive. So, mind you, I'm only a couple of weeks in. Not very, very huge on the HCG yet. The first couple of tests I took, they were negative. The last one was positive. I just happened to have a gynecologist appointment coming up, so I was like, I'll just let them know. So that next Monday, so the next week, I go to the gynecologist. So I'm roughly about 3 weeks in, I guess, and they take the P test, and it's positive. Now Zakaya, she's adamant she needs to get the ultrasound and all that stuff too. We end up getting an ultrasound a week later, even though apparently in Florida you're supposed to be at least 6 weeks before you get your first ultrasound. So they accidentally scheduled it a little too early. And the lady who was doing the ultrasound, she was like, "Did you pay for this?" I said, "No, ma'am." She said, "Okay, we're going to go ahead and do this, but only because you didn't have to pay for it. But this is too early. You're not supposed to come to your 6 weeks." She does the ultrasound, and I'm 4 weeks and 5 days, supposedly. Now, during this ultrasound, she mentions that my egg sac is a little bit big. And she also mentions that they're gynecologists, not OBGYN, which, all my life, the majority of my GYNs have been OBGYN, so I never really thought about it. I had to go find me an OBGYN. But I couldn't get a referral yet because I wasn't at least 6 weeks. So I had to schedule another ultrasound. So in my head, I'm thinking, she said the egg sac is a little bit big for the amount of weeks it is. I'm already considered high risk. I know this from my last pregnancy. My daughter's only 2.5. I was high risk then, so I'm probably high risk now. So I go and see my PCP. He thinks I need to see the doctor right away. I tell him they won't let me see the OBGYN yet because I'm not far enough along. He says, "Oh, no, no. I'm going to write you a referral." I start calling these places. They're like, "How far along are you? When was your last period?" "Oh, no, we can't see you yet." "I got a referral from my PCP." "Oh, well, he's unprofessional. He's not supposed to, he knows he's not supposed to write the script." I said, "How is that unprofessional that my doctor actually cares about me and wants me to get the help that I need?" Now, I'm so sick and I'm trying to keep living because my daughter, she's young. She understands something's changing. Her attitude's starting to change. She's worried because I'm sick. Every day we get home from her classes, I'm laying on the floor. I feel so crappy. And these doctors won't see me. But I wake up one day on a Thursday and I'm spotting.
I'm about 7 weeks, I think. I can't tell. 6 weeks maybe. I had the. I'm supposed to have the ultrasound on Monday, but or no, I was supposed to have the ultrasound 2 weeks 2 weeks away because they gotta wait. They want to make sure that they're far enough along, even though they know I'm pregnant. We gotta make sure that I'm far enough along that they can have a confirmation for medical records. Because 5 and 6 weeks isn't far enough along. Whatever. So I go to the ER, and these people, they take all their tests. They do the transvaginal ultrasound, and they heard my baby's heartbeat. And they told me that the heartbeat was low for the gestational stage, and the sac was too big, and that I had a subcutaneous hemorrhage. And even though they thought the heartbeat was low, their ER doctor, they want me to see a normal doctor. It's a Thursday, and I have to get an appointment within 2 days. Keep in mind that Saturday and Sunday to the medical community. It's not days. So I go home. I go home and I try to make that appointment on Friday, and I don't have any luck. And I try all day Monday and Tuesday, and I don't have any luck. I end up back at the hospital. Now, when I go to the hospital, it's because my blood pressure is going crazy. It's been 2 weeks already. But I finally got an appointment after the hospital because I bought the hospital papers up to my old gynecologist. And I told him, hey, I really need to see somebody. I have a subcutaneous hemorrhage. And they fit me in at what they considered was exactly 8 weeks on a Monday. When I ended up at the hospital the second time, I had to choose between looking at my baby or checking my heartbeat. I had to choose which problem I could have them solve. And of course I'm thinking my babies should be fine. But my heartbeat needs to be clear so they can continue to stay fine. So I let them do an EKG and I let them do an x-ray and they tell me I'm perfectly fine. And they send me home. And when I go to the doctor's on Monday, there's no heartbeat for my baby. And not only is there no heartbeat for my baby died the first time I went to the hospital. While I was laying in the hospital and getting ready to go home, they were already telling that's why the fetal heartbeat was so low. They died the same day. That very same day they didn't grow anymore.
Hmm.
And they can tell all that on the ultrasound. They sent me home and not only did they not notice that my baby was dying, neither did I. I was so happy about being pregnant. Mine failed to acknowledge what my body already knew. And my body was so sick, and I could barely get off the floor. And I kept trying for my baby, but she knew something was wrong. And she started acting out, and she started telling me that they were gone, and she started having night terrors. And I didn't know what was going on. And then the doctors told me, and my baby's still having night terrors, and she's asking what happened. At some point during the first 6 weeks, she started saying she had a sister in there too. And both of us were dreaming that there were twins. I don't know if it's true. The X-sac was big enough for it to have been, but they can't confirm it because they can't see that till around 14 weeks. So we'll never know. I couldn't decide whether I wanted the remains or not. I couldn't decide because they can't confirm it either way, and I don't want the birth certificate because I can't get one for one and not the other. And I don't know what to do because I feel up and down, and I had this huge support group and all the women around me. yet it's the most alone feeling. And I know so many other women have gone through it. My mom, my sister. I don't know if any of you in this group have gone through it, but no matter how many people you're surrounded by, the world keeps moving. It's not like a normal death. It's not like when your grandmother dies, everything stops. You stop working, you head home, you catch your flight to where you need to be. Everybody surrounds each other, and there's food and there's grieving. But with the miscarriage, everything keeps going. You're the only one who's sitting there with a funeral to yourself. There's no memorial because even with the memorial, you have to pay thousands of dollars to have this little bitty thing put in the ground. So you don't know what to do. And one minute I feel like maybe I deserved it, and the next minute I'm like, no, God does things for a reason. He never gives you more than you could bear. It's up and down. And I know there's so many women that understand it. And when I was talking to my therapist, he mentioned that there are 40 women a minute who have a miscarriage. That's crazy. When they were booking the procedure that I had to have to clean my baby out, when she called me, she said, we're going to book it for next Thursday. And mind you, this is like a Tuesday. I said, excuse me, the next Thursday? And I buzzed it out crying. I didn't get angry. I just was like, oh my God, that's so far away. And this woman took pity on me. She was like, yeah, at first she was like, well, ma'am, some people wait 4 or 5 weeks to do this. I was like, oh my God, that hurt my feelings so bad that there's so many women that wait weeks to get this procedure to help their body expel their dead baby. It just was so overwhelming to hear that I just cried in her ear. That's just one of the saddest things that women have to worry about their babies are dead in their body. And you hold on to it because your body won't get rid of it for you. Like, how do you even explain that to anybody? How do you explain that your body, your mind wants this child so much? Your body won't get rid of it. That's, that's just one of the health stories. I don't want to keep going because I want y'all to be able to hear your stories too. You
I
should
I wanna
start
tell you,
self
like,
care at
everything
the
you're feeling
beginning
is
of
is
pregnancy.
valid. It's gonna you're the the difference, even the going back and forth, it's all valid. It's all part of you're grieving for your child. Like, regardless of whether it was 2 days old or 8 years old, like, that was your child that you're grieving, right? So and you had to go through all these medical barriers. I was here when you were calling over and over and over all these people, and they're like telling you, "Ah, we'll help you later. We'll help you later. Just
Some
don't
of them
worry,
were just
you're
so
fine."
rude. Some
And
of
they
these
were
front
very
desk
rude.
people, oh my goodness.
They're
If
not
you work at the
they're not
front desk at
helpful.
a doctor's office, please find some compassion or empathy or quit. Like seriously, people already are going through enough in their lives to have to call and listen to someone who is having a bad day. Suck it up. You're at work. You're at work. I didn't call to hear you have a bad day. I'm already having a bad day of my own. I don't need you to be mean to me. I need you to have some compassion. When I finally talked to someone who would listen to that I had a subcutaneous hemorrhage and my egg sac was too big and my hormone levels were ridiculously high, she was like, "Oh my dear Jesus, you need to see someone right away." And she still couldn't find me a doctor, but she was nice. She listened. She couldn't find an appointment. After all that, she was the first nice person I found, and the person who was mean had an appointment. But the way she was talking to me, I knew when I got up there we would argue. Cause she was like, "How far along are you?" And I told her, and I said, "But I was in the ER." And she was like, "Oh, ma'am, that doesn't matter." Excuse me. I'm sorry. What did you just say? That doesn't matter. Why doesn't it matter that I was in the ER? Oh, because we've never seen you, ma'am. So you need to please be quiet and listen to these questions I'm going to ask you, so we can try and get your first visit. And once we get your first visit, then you can tell us about the hospital. Oh no, ma'am. No, ma'am. Thank you so much. You can go ahead and scratch my name off your list. I won't be coming in. Thank you. You have a great day. Like, come on. Like, what is the problem?
Well,
Why
the
would
other
you
part
treat
is
someone
that
like
there
that?
are so many barriers to care that that you even talked about. Like, you have to be so many weeks along for them to even see you, to even schedule you, even at high risk. There's not really a lot of information available to just regular people to understand the difference between an OBGYN and just a GYN, right? I didn't know there was a difference until Farah mentioned it, and I was like, "You're right." I've seen, like, in the list when I search, but I've never had anybody who was not an OBGYN, so I never thought about it. And since I've never gone to just a gynecologist who was an OB, I know there are doctors that specialize in obstetrics, and it makes sense. But unless we get that continuous thought process, um, then we remain unable to make these decisions for ourselves.
What's the difference
Sarah,
between
I'm
the
so
two?
sorry.
A GYN is a gynecologist and an OBGYN is an obstetric gynecologist. So with OBGYNs, they focus on prenatal care and care throughout a pregnancy versus a gynecologist who focuses on women's care. So the OBGYN can do both, and most of them do, but gynecologist only focuses on the women. There's no prenatal. I
Thank you
didn't
for that.
know when I switched. We just when we moved towns, I switched doctors, so I didn't even think to be like, "Oh, is this also the OBGYN?" There was a recommendation, and they were good doctors. They were really nice. Just like I said, I couldn't get confirmation. And even though I know I'm pregnant, you know I'm pregnant, the ultrasound knows I'm pregnant. Due to medical regulations, we can't proceed with my care until I get to a certain amount of weeks. And that's not fair to someone who's high risk, unless you're with like a fertility doctor or you're at a constant care with a doctor already. So I did have a high risk doctor from my previous pregnancy, but I can't see them till I'm 10 weeks apparently, which I found out during my DNC procedure. So that was definitely interesting to find out that I would have had the miscarriage before I saw him anyway. So they can see that you're high risk and they can still be like, well, sorry, until we can get paid by the insurance. Or maybe if you want to go out of self pay, we're not going to see you. And they don't really ask you about self pay because I willingly go ahead and pay out of pocket to make sure that my baby makes it. You can't truthfully tell me that everything was done if you couldn't see me beforehand. Right now, what I'm being told is your body would have lost the baby no matter what. But how do you know? How do you know if you hadn't recommended that I get more iron? Because for some reason I wanted meat a lot. I didn't want any sweets, which was ridiculous because my glucose was really high and I couldn't eat sweets. And my salt was really low and all I wanted was salt. So you don't know what balance I needed, what type of supplements that you could have recommended to help me to get me better because you didn't try. You can say what you want to say and say, well, thousands of women go through this daily, which is true. But
They
you
can't
don't know
really
if
tell
you
you
could
one
have
way or
helped
the other
them.
because there was
Yes,
no
until you
they
start at
didn't do
week
anything.
whatever week they find out. Some women know instantly. With my first pregnancy, I knew I was pregnant like 6 days in, but I still couldn't get care. I just got lucky that she made it. And that's what most of us are. We are lucky and blessed. God blesses us to carry these babies. And I know, like I said, he never gives you more than you can bear. But do y'all have any stories to share?
Thank you so much, Farah, for sharing that. It takes a certain level of bravery to share that story because even though, like you said, thousands of women go through it every day, sometimes, they all feel alone and there's some stigma behind it. And for whatever reason, we feel like sometimes we have to close ranks and when we're most vulnerable and kind of shut the world out. So I think it's really amazing that you're sharing this so openly with everyone. And I hope it encourages other people to be able to share their stories and share their pain because they're not alone. It's a very lonely feeling, but you're not alone. And we're all in this together. So thank you for sharing. I know that was hard. And yeah, it's not less tragic just because it happens to so many people. Each time it's yeah, there's that grief, there's that loss. So I commend you for being able to speak out on it.
I think it gets lost sometimes in the discussion because we're so focused right now on women's rights, and it leans towards having abortion rights. Um, we want to have the ability to control our care, and that's really the
Whatever that
core of
looks
it,
like.
whatever it looks like. It's not just about being able to have abortion. It's being able to have an abortion when it's necessary, when it's right for the mother, being able to guide our care, get care earlier on when we need it, when we need it for, pregnancies that we do want to go to term. Being able to understand what's happening in and with our bodies and have input into that care. And so, like,
within a
it's a
reasonable
huge
time
thing.
and
Within a
not having
reasonable
to
time,
jump
it's
through so many
huge.
hurdles. Big
Exactly.
time. And Jillian and I worked in the same ER for some time, and we saw a lot of women that were experiencing miscarriages, unfortunately. And I remember listening to her talk to a patient, and she was encouraging this young lady. She said, if you were able to get pregnant once, that means you can do it again. You have this opportunity, you have a chance to do it again. And I'll be honest, that stuck with me. And I still tell women that to this very day. So I'm really glad that I got to witness you doing what you do firsthand, because it is inspiring. It's so hard to know what to say in these moments. Um, but I would love for you to share some of the other encouragement that you've given people or advice that you've given people that have been faced with the loss of a wanted pregnancy. Anything that you can give, I think, would benefit so many people.
So what I do to a patient usually is it's for me to do a miscarriage or to tell a patient it's very heavy on my heart. And not because I previously had a miscarriage, but because my sister thought she was having one. And just the thought of it, I understand how it can be stomach for a woman. And then to tell someone that they've lost their baby that they're excited for is, like you said, it's grieving, and there's no grief. It's just you by yourself, maybe your spouse, right? Um, all the time is that it's nothing that you did. And I try to explain the process to them. The action is the best tool for us to understand, right? So I try to make sure that women understand and they're educated on what's going on with their body. As much as it's more factual and less emotional, I think when we have all the facts, the emotion's not going to change, but the facts kind of help us with the grieving process, right? Um, there is a loss, but why, right? And was this loss something that could have been prevented, or is it something that I did, or something that somebody else could have done to prevent? And then a lot of times, if they're at ease with those things, they're going to still grieve the loss of their child, but they'll understand why. I feel like a lot of times, even dealing with my family members, we don't get practitioners, this is where we're lacking, always explain to patients at a level where they're comfortable and they're understanding, because we're rushing on to the next patient, and it's not our feelings, right? So it's kind of a lack of empathy and understanding for the patient because you're worried about getting to the next one, where a lot of the times we have to remember that when we're with that one patient, that's all that matters, that one patient and how they feel at that point and that time. It's not the one that's in the room next, it's just that one patient and you, period. Because they are having that feeling with you as their provider and that connection and that trust.
Yeah, in that moment. That's what's real for them, is what's happening in that moment.
So the guy who did my DNC for this pregnancy was my high risk doctor. And truthfully, I wasn't gonna go back to see him for this pregnancy. So they did monitor my pregnancy in a capacity last time. I'm considered high risk for a couple of different reasons. I do have some spinal issues, which is a whole nother medical story. Um, I do have some gastrointestinal issues, and I also have some misfiring in my brain. So sometimes um, my brain might tell my colon to swell, or it might tell my legs that I'm restless or something. I really don't really understand that particular thing. I was told that I have a misfire in my brain after getting tested for every immune disease that was possible for months. And then they were like, "Yeah, you don't have any diseases. Your brain just misfires." So I don't really fully understand that one, but anyways, I was with the high risk doctor at the last pregnancy, and I did not want to be. I didn't want to rush my baby out. I didn't want to be induced. And the reason why I didn't want to be induced is because there can be a lot of complications with induction. And I felt like I was healthy enough. And they kept telling me that I was sick. They did. I felt great. I didn't feel great. You know, I'm pregnant, so I'm nauseous. People stink because your nose becomes a wolf. You know, a wolf's nose when you're pregnant. So there was some uncomfortable stuff, but I was like ridiculously happy because I'm older. You know, I was pushing 40 already, and we finally got pregnant. Like we decided to have a baby, and not only did we decide to have a baby, we got pregnant on the first try. After doctors told us that it would probably take years. I had been sick for a while. They told me not to get pregnant. We wanted to get pregnant since 2021, and I was having all these health issues, and they were like, "Oh, you can't get pregnant because of this. You can't get pregnant because of that." We finally get cleared, and they're like, "You can get pregnant, but it's gonna take a while." And we get pregnant like right away, the same week. But anyways, so towards the end, they're like, "Hey, we want you to get induced at 30." Originally it was 37 weeks. I don't want to be induced. We really want you to get induced. No, I'm not getting induced. Can you please bring your spouse in? Sure. Talk to him. Get in his ear, you know? Tell him all the reasons why I need to be induced. She has high blood pressure. Bruh, I've had high blood pressure since 2011. Give me a different reason. You have you have diabetes. You say I have diabetes, but you told me to eat carrots and peanuts and stuff, and my glucose went up. I ate cheesecake and my glucose stabilized. I'm just saying. I'm arguing with these doctors back and forth because everything they're doing, all these tests they're taking, they're really messing with me. Ever since my baby was, I think, just a couple months old, if Jessica could help refresh my memory, they put me on a diet. They're like, "You're so small." For everybody who doesn't know, I'm almost 5'2". I'm 5'1" and 3/4. But you know, for this
Three
precious
quarters
height,
counts. It's important.
yes,
Include
it
that
does.
three
For
quarters.
this precious height, I am not exactly obese, but they call me obese. If people see me, they get upset that my doctors call me obese. But I was in the 130 range. So for my height, that's obese. So those all these things together make me high risk. And I'm pushing 40. Oh dear Jesus, that's geriatric in mother world, okay? You are an old person. So we're arguing back and forth, and he convinces Mike that I need this induction. Now we're doing parenting classes, and the parenting class is like, "You have the choice. Don't let your doctors force you to get an induction." I'm like, "I have the choice." I said no. They get in Mike's ear, and I'm like, "But baby, I really don't want induction." He's like, "Babe, you can die, and this, and that, and that, and the third." And I'm like, "Yeah, I know all the facts. I just don't care. I just want to have my baby normal." Yeah, we end up having that induction. 38 weeks. I never dilate. That's what happened. I didn't want the induction. So I start off, you know, we go in, I think it's like 7:30 at night. They start their medications. I'm not even a centimeter dilated. The next day, 9 o'clock in the morning, I'm not even a half a centimeter dilated still. I'm not opening. You know, after so long, they decide I need a balloon. Now,
Which
for
is
those who
crazy
don't know what a
because
balloon is,
that was less time than Francis even took. Francis took longer and
for
they didn't
natural
do
birth,
that
right?
for a natural birth.
So during my pregnancy, I had an unusual pregnancy because everything about me always has to be unusual. My baby was behind the placenta. I couldn't feel her. We could barely hear the heartbeat when she kicked and stuff. I couldn't see it like that. She had to be in my ribs for me to feel it. I felt that. Ooh, dear Jesus, I felt that. But so during the induction, when she still wasn't ready to come out, because my baby's she's bullheaded. She does what she wants. I'm not dilating, so they tell her, "Oh, you
Like
gonna
her
come out?
mama.
We gonna put a balloon in." When I tell you I got my first contraction, I had, I've apparently been having contractions, Braxton Hicks, for weeks. They tell me supposedly because I'm taking these stress tests, and they're like, "Oh, you're having a contraction." I'm like, "I am." Oh, that's so cool. I don't know what a contraction feels like, but they put this balloon in. Dear Jesus, you feel all the contractions, and it's a balloon inside your vagina, so it's trying to space open. It's slowly opening to open and dilate you, right? I
I
didn't
don't
dilate.
I don't wanna have any
I
more kids.
didn't
I don't wanna have
dilate.
any more kids anymore
After a couple of
after that.
I want
hours,
children,
they're
and
like,
that's terrifying.
"Sorry, you're still not dilating, and your baby's heartbeat is starting to drop, so we're gonna have to do an emergency C-section." I told you I didn't want to be induced in the first place. I should have just I should have done natural birth. All this.
It's important to listen to your doctors, but it's also very important to listen to your instincts. And like we were saying in the beginning of the episode, to advocate for yourself because nobody knows your body quite like you. So while doctors have a certain level of expertise and knowledge and we value and appreciate them, it's very important to listen to your instincts as well. Now if you were actually already in distress, I'd have been like, Farah, bump your instincts. You gotta do what these people are telling you, but you weren't in that place yet. So it is very important to advocate for yourself, 100%. And I feel like oftentimes when we don't listen to that little voice in our head, we usually end up regretting it. Every single time I've denied my instincts, I just be pissed. I'd be mad. I'd be like, dang it, I knew it.
Absolutely.
Ah, you know, and
Yeah. Yeah.
and then if you do
What do
it
you
enough
do when
times,
doctors feel like they know everything and they want to bogart their opinions or their facts? I'm doctor, I got a title.
it's important to have that documentation. So if there is a doctor that's insisting it's more like their way than the highway, they're not
Highway,
really
yeah,
listening to you,
yeah.
it's
Mm.
important to have that documented and say, okay, Dr. So and so, so what I'm hearing is this. I've requested that. You are denying these tests. You are denying this other type of treatment. May I have that in my record, please? May I make sure that's documented? And you also have a right to ask for a second opinion. Now, sometimes if you sit there and say, I want it in my record, they might say, okay, well, you know what? We'll try it. We'll just see.
I
Some
changed
of
the tune.
them will start to change their tune. Not all of them, though. And if they still insist that it's their way or the highway, your thoughts on the matter don't matter, like Jillian mentioned earlier, it might be a good idea to switch up your doctor. It might be a good time to go ahead and seek a second opinion. And again, if you are not in some type of medical crisis, this is the perfect time for you to advocate for yourself and keep pushing. Now, if it's a matter of life or death and every second counts, you don't have a lot of wiggle room, right? But if you're in an outpatient setting and your doctor is not being receptive to you, there's no way you can build that healthy relationship and trust to get you the real care that you need. You guys have to be able to trust one another. And that only
Mhm.
happens by building relationship, by listening. And you can even tell your doctor. You could come in with your list of concerns, your questions, and just be very clear about what you're trying to say. And you can even tell your doctor, I'm not feeling heard in this moment. I don't want to waste your time. I'm sure you don't want to waste mine, but I just want to say I don't really feel heard. And if at that point, you're not making any headway, it's probably a good time to switch. But sometimes you just have to talk to them like they're people because that's what they are. I value your expertise, Dr. So and so, but I don't feel like you're listening to me. I don't feel like my thoughts are being considered in my care.
I tend to ask very specific questions and request very specific answers. So I don't just ask, "Hey, what's the diagnosis?" I ask, "Okay, what specifically does that mean? What is the intent for the care? Like what is the end goal? Where are we going with this?
How did we get
What
to
does
this
that mean?
diagnosis?
How did we get there? What tests did you run specifically that told you that was the way to go? What test are you running now to that I should expect a change on? What is the change that I expect taking this medicine? Right? I don't want
And
to
how
know
long
just,
should I
hey,
wait before I
how
start
long
seeing the changes?
exactly. Like how long am I gonna wait to see the changes? If I don't see any change, when should I call you? Um, are there any side effects that I need to be aware of? I just want to remind you that I have asthma, I have migraines, I have this. So is there any reaction that I can expect from this medicine and this other medicine that I'm taking? I ask very specific questions whenever I'm talking to a doctor because a lot of times that will almost narrow down what exactly is going on. And sometimes they will change to say, okay, oh no, I forgot that you had asthma. I can't give you that specific medicine. Or, oh, okay, well, that is true. It's almost like they're talking it out with me about
Yes.
what the end
Yes.
result that they're looking for.
And that's the
And
thing. Your doctors are people. And I know
Yeah.
me as a people, sometimes when I verbalize something, it's because I'm walking through it, right? I don't know that I know until I say it. And I'm actually walking through the logistical steps. So if you have to do that with your doctor, that's okay because they're people. Sometimes they have to go ahead and walk it through. And they'd be like, oh my God, you know what? You're right. And that's okay because you guys are having this meeting of the minds. You're coming with your concerns and they're coming with their expertise, and together you're figuring out the best way to move forward with your care. Your
So
doctor's not going to be perfect. They're not going to remember everything. It's on us to continue to remind them to bring forth as much information as possible and not to be shy about saying, well, I don't really agree with that. What else can we do?
So
Right?
what do
And that's
you do?
team
okay.
approach.
And the question that we were asking, Jillian, is that what do you do when you feel like your doctor is kind of more of a my way or the highway approach? And how do you navigate that? So if you have any tips
You take
for
the
us that
highway.
are on the other side, take the highway.
You
I
take the
love it.
highway. So your provider patient relationship is all about teamwork. And I tell patients all the time, my job can only go so far. And then you have to come the other way with me. But if your provider is telling you no, it's this way only, then you're obviously not with the teamwork. I need someone that's going to be on my team, and it's not just a cookie cutter for everybody. Everybody's different. So if they say it's my way or the highway, well then it's the highway until I find someone that I can work as a team with.
It's
So what do you
huge.
do when you have one doctor that seems to be trying and they're doing all those referrals and they're doing the due diligence and they're asking all the right questions, but none of the other doctors will listen. My PCP actually does care. He listens. He gives me referrals. He's like, okay, whatever you need, let me make sure we want to get you feeling great. And then the other doctors are like, he's just a PCP. Why did he even send you here? You need to go through this doctor, and that doctor before you could come to this doctor. It's like, what? What just happened?
Something you can try is that if you have that one person that is being a true advocate and cheerleading, that doctor is trying to do everything, but other people aren't being receptive, sometimes they need to have a doctor to doctor communication, right? You can go back to your PCP and say, I'm trying to do all the things you told me. I brought the referral to so and so, three other people, and they're just not responding. You can ask the doctor to get involved. So you can ask your PCP, do you mind calling? Do you mind, emailing so and so? Can you send over a fax? Fax them something. And when the doctors actually start communicating directly, it tends to go a long way. Now, I've worked in many different hospital settings, different healthcare settings, and nothing seems to get people moving like a doctor saying, "Hey, Doctor so and so, can you just do this? Can you just humor me?" Right? They could tell us no easy. They're like, whatever, get out of here, you know? But when it's another physician making the direct request, sometimes it does kind of move the needle some. Now, if the request is completely ridiculous and outside of the other practice's scope, they're still going to shut it down. But if it's within reason, a lot of times just that doctor to doctor communication can kind of help move some things along. So if your doctor's willing to do,
So a lot of times as your primary care doctor, 'cause I've been in that role before, and you send a patient out to a practitioner, thinking that they're going to necessarily give your patient the answer. They don't have the whole picture, right? And so I tell patients all the time that your primary care is the captain of your ship, which is your body. They are the one that are sending you out for all the different referrals. So say you see the cardiologist, but you also are seeing the pulmonologist and the rheumatologist. Well, they're not all getting the same pictures that your primary care doctor is getting. So a lot very frustrating for patients because they're seeing all these specialists and not getting any answers. And that's where your primary doctor comes to play more to navigate all that information that they're getting back to give it to you in a way that to build a case to say this is what it is, right? Or to say, okay, this is what I was looking for, but this is not where they went, so we need to go somewhere else. So it can be very frustrating from the patient side because you feel like, well, I'm going to the specialist, they should give me the answer. They don't always have the answer. And sometimes that lies with your primary care doctor.
because they don't
Exactly.
have the full picture.
So I understand how it can be
Mm.
overwhelming and just daunting and like, I don't want to do anymore. And that's where a lot of times we stop because we're like, we're done. We've done all the specialists and we don't continue with the care. But I would tell you,
How come doctors aren't set up like hospitals are? So when you go to the hospital, you get this whole team of specialists. You get the ER cardiologist, you get the ER radiologist, you get the ER rheumatologist, you get the pulmonologist. You get all that all at once, right? Even sometimes when they're just like, oh, we're only going to work on this, but then they see something, this ultrasound, so then they get you this, and then they get you that. Because they only start with one thing normally, but if you have more than one thing, sometimes they can't help themselves. But then when you're at your doctor and they're sending you to all these all these different people, how come they don't live in that same world where, like on my chart, it says that all the doctors can see all of this information. So if you can see that I went to this doctor and that doctor, how come you're not the one doing the research? If why does the PCP have to be the only one doing the research? If you're my heart doctor and you know that it could be related to my lungs, or if you're my gastroenterologist and you know that it could be related to my cervix, why not look at that information on your own if it's right there at your hands instead of worrying about the PCP
so usually
navigating
specialists are
everything?
going to look at their area and see if there's anything that might correlate with it. Like even when you come into the ER as an ER provider, you can see what your primary care, any like relate to why you're here, right? But I am not going to get the full picture of your medical issue. I'm going to get what you give me and that little bit that I can see. I know you or your temperament or how you are you, right? As whereas a primary care doctor, when I've been in that role before, I had a patient that came in and said he had hiccups. My patient was even in my office requesting a same day visit was alarming to me because I knew my patient, right? So then I'm saying there's something, this person doesn't always come in. This person's not a complainer. Like, what is wrong? Found out that he had an aneurysm, right? But the only thing that he said is he had hiccups, right? But as your primary, you know your patient. Like your primary care doctor knows that you complaining, get to the bottom. Looking at your heart, bam, your heart looks good. Next, on to the next. Oh, your lungs look good, on to the next. Their job is just that area. When you come into art, I'm dealing with just what you came into consult with. I'm not looking at your diabetes, your high blood pressure, all of that, all okay. I'm just looking at here right now.
I think that's a very good point. They're getting a snapshot, right? They're getting a little snapshot of what's going on. And like Jillian said, they're seeing you for the first time as opposed to your primary care physician who has that relationship and rapport with you. So it is very important that when we come in, kind of what Jessica was saying, is that we're asking very specific questions and giving as much information as possible. And even though they might have access to your My Chart, one of the things that's built into my chart and a lot of EMRs, electronic medical records, is it keeps like an audit of every single click that you make. So if you're not necessarily supposed to be in that particular part of that person's chart and somebody says, well, I was violated some way, that could count against them, right? So they're focusing on their particular scope, their expertise, so they can speak to that. And they also aren't supposed to be just all everywhere. You know what I'm saying? So some of it is like an infrastructure thing, and a lot of it is how much information do they really have access to, right?
But
And there are
isn't
even
that taken
doctors,
care
even
of
though you
when
see a
you
lot of
give the
doctors, not all of them
verification?
have access to my chart because doctors' offices have to pay for that. You would think it would be free. You would think that it should be readily available, but no, it requires a certain number of like resources to build that infrastructure. So not everybody has it. There's doctors' offices still to this day that use pen and paper and fax machines and so on and so forth. So they're at a disadvantage. So it is important for us to continue to advocate, to be very specific, and to try to give them as much information as possible that is pertinent to what's going on in that moment. Because I wouldn't necessarily think hiccups is a big deal, but if they manage to connect the dots somehow, that's how Jillian was able to find out what was really going on.
The
So
problem with that for
sometimes,
me is that the problem with that is that you're expected to only go over certain things in a certain time frame. Like first of all, a doctor's appointment is only 15 minutes long. No matter
yeah,
when you go, it's 15 minutes long. You wait for 30 minutes to an hour and it's 15 minutes long. It's scheduled as
yeah,
15 minutes long. And you know that you have that much time. And they're already checking their watches in the middle of it. It's already like, hey, I know you have 20 issues right now, but we can go over two of them today.
yeah. Or where they do that
So
thing where they have their
the
back turned
doctor
towards
will
you
be,
and they are typing the whole time
yes,
and they don't even look
yes.
at you and you're like, "Excuse me."
Or even
Hey,
while you're
Jillian.
sitting there talking, they're like doing something else and they're giving you like small answers, or you're trying to be specific about your particular care and they're like, oh, no, no, this and this. And they're like brushing you off and dismissing you. And you're like, yeah, but
That's
I read
why
this. You need to stop getting on WebMD. It wasn't WebMD. It was this particular article in this Kaiser University.
yes,
I went and did some
yes.
research. Like, you're not
But
listening to me.
again, that's why you have to be very specific with like, you have to try your best to come in prepared. Is it fair? No. Are you being asked to navigate a very, like, niche professional situation with just having layman's information? Absolutely. But you are the most educated on what's going on with you, so you have to be super specific with your symptoms, how it's impacting you, what you're expecting for your outcomes to be. Have a list
What
of
if you don't say
questions.
though?
Have a list of concerns. That's when you have to find the kind of
It's not
provider like
always
Jillian that actually
helpful though.
listens. Hmm?
Yeah, it's not always helpful though. Like I've been to a doctor who was like, uh, so what do you want to do? And I'm like,
I've had that experience too. They're like, "So what
No,
do
I
you
it's
did
think the next
not
not.
go
step
to
should
school
be?"
for
"I
this.
don't know.
I
You're
didn't
the
like
you're the doctor."
you're the doctor. Like I've been to a doctor a couple of times when I hurt my foot. Earlier this year, I they were like, do you want crutches or a boot or something? I was like,
Be
I
best.
don't
You tell
know.
me, please.
You tell
So
me
then you
Please.
have
what
to
do I
That's why I
choose
need?
came to see
And
a
that
you.
was
doctor.
and it's crazy. It's frustrating because you're
It's
like you're the one who this is everything that all of my charts are available. You are within the same network. You know,
yeah.
I've given you the information on what happened. I gave you the information on like any previous ailments that I've had. I don't know what to tell you because I don't do this for a living. If you want to set up your internet, call me. I
That's
got
my
you.
expertise.
That's me. However, when we're talking about medical, this is why I come here because I can't do this on
Yes.
my own. I don't know how to do this. And I think that's part of what Farrah is speaking to is that there is a frustration from a consumer standpoint.
What do you do when a doctor molests you and you don't know who to turn to? Because a couple of years ago, after I first had my daughter, when I was first referred to a doctor, the doctor who I went to is a child doctor and an adult doctor. And when they did my pap smear, everybody knows the pap smear doesn't involve the clitoris. And he involved my clitoris. And it actually made me stop going to the doctors for a whole year before I started going. And I have health issues, so that probably wasn't the smartest idea. But it took me a while to be able to say, okay, I guess somebody could go and dig around in there and make sure everything's okay. And I tried to report him, but I didn't know who to report him to. There's so much paperwork to try and just let somebody know that someone's a pedophile or a molester or anything. I did some research and I was referred to him originally by Advent Health in the first place, and I thought he was affiliated with Advent Health because you could see him in my chart. But then when I tried to report him, they were like, he's not one of our doctors. And all of a sudden, I have nowhere to go to report this doctor. And like I said, he's a child doctor, and I don't know who to go to. And for a while, I just didn't want to see any doctors. It took some convincing from my sister and Mike, but I went back, and it was a journey. But he still needs to be reported. I'm not gonna say his name on this podcast or anything, but I do think he needs to be looked into. He's a child doctor, so I want to know who to report him to.
So you can always report any physician or practitioner to your medical board of your state.
And how do I go about doing that? Is there like a website, or is, because when I was looking, I'm not the best at the internet, and for the most part, I was looking inside of Advent Health stuff, trying to look it through their complaints and stuff. And I did try and look up, but it mostly just brought up ads of lawyers and stuff, and I did get overwhelmed, and I was already in an overwhelming situation, and I gave up at the time. But with Jessica's persistence and on my content, like we said, he's a child doctor, so he
They
needs
have a
to be
website,
stopped.
Florida
So
Board
if
of
you usually
Board of
if you're
Medicine.gov.
yeah, board of medicine, and then they will have a place where you can file a complaint.
And I didn't tell them at first either because I felt embarrassed. Here I am, 40 years old, never been molested by a doctor all my life, and
You
it's like
never should have been.
he
You never should.
he made it seem like he wasn't doing anything when I jumped up like, whoa, what's going on? That's not a normal path for me. I've been having these since I was 16. I've never been touched like that. What's going on? Like,
But
I
that
mean,
is
I'm joking
part
about it
of
now, but it was
that's
like
part of
for
the
the
abuse. That's part of the abuse. That's a tactic that abusers do use. So
I just
while
so
you were
shocked.
embarrassed and whatnot, there's nothing for you to be embarrassed about. You did absolutely nothing wrong. And it's important for us to speak out when this happens, just because, like you said, you want to be able to protect other people. And it also helps reclaim some of like your strength, right? It helps take away the victimhood when you can stand up and say, you know what, I did something about it. Right? Because I think there's a difference between being a victim and a survivor. And we are both at sometimes. You might be a victim longer than you are a survivor, but I promise, they both kind of go hand in hand. But when you actually stand up against it, it helps bring you out of the victimhood and into the survivor, into the I overcame this, I did something about it. So it's there's a lot of stigma still when people speak out, but there shouldn't be. You're doing something strong and brave and courageous, and there is a network of people out there. So, yeah, and any state that you're in, there is always a medical board. They have to be licensed with someone. You go after that licensure, and they are going to take some action against that. Absolutely. You're not just helping yourself, you're helping your community, you're helping the next person, your sister, your uncle, your cousin, your brother. So, yeah, it's not easy, and nobody should ever have to go through that.
And I wanted to touch upon the fact that we're talking about a lot of uh, basic medical things that the medical doctors, but we also see the same type of things happen in dental care, vision, other parts of the medical community that are very much we get different care than other people. So it's just thought that Black people can take the pain and lots of different things. I, as you guys know, we've had conversations about it before. I've had lots of dental issues. I had a dentist who, knowing that there actually really wasn't anything wrong with my teeth, he did dental work on all of my front teeth. Um, and eventually, he said, "Well, I'm not going to finish because you can't pay." And eventually my teeth broke, and I ended up for a couple of years just walking around with broken teeth and broken confidence. I it was really a very trying time in my life, and then even after getting my teeth repaired, and this is I had to like crowdfund to get my teeth repaired because at the time I didn't have enough money for it. Even after that, come to find out years later, and I'm talking like 4 or 5 years, I'm continuously getting dental work where he was ending up causing more dental work, so he would hit other teeth as he's doing dental work, then I need to get more dental work done. Um, and I didn't realize that's what was happening until later on, and I thought that Novocaine didn't work on me. I was under the impression that Novocaine doesn't work on me, that I am resistant to Novocaine. And so I would go under 2 to 3 hours of dental work, and I would be numb for about 20 minutes of it. And so I got to the point where I would go in for dental work and I would have the shakes. Like I would have high anxiety. I'm like I lay back to start the work, tears are running down my face. Of course, I'm very much stoic. I know I just have to stay through the pain. So I'm like, okay, and just silent tears running down my face the entire time as somebody is working on my teeth with absolutely no Novocaine. And I only realized this because I went to a different dentist when I moved to a different city, and I told him, "Hey, I'm resistant to Novocaine. I just wanna let you know I can't do laughing gas. I tried it one time. I had an asthma attack. I have asthma. There's really not too much I can do." I lay back in the chair. I start having the shakes, and they're like, "Okay, we're gonna start really, really calmly. Just grip my hand if it starts to hurt." They put the Novocaine. I noticed that it's not in the same place that I normally get it, and coming to find out that the other doctor had never put the Novocaine in the right place. So the entire time, there was nothing wrong with me. They were administering it wrong, and I basically got had been going through this pain several years in a row, and they noticed wherever I had dental work, there are teeth next to it that were damaged. So, I had to get more dental work everywhere where I had dental work already in my mouth. So, like, these sorts of things, and this was a dental care office in a Black community, centralized to a Black community, and it's still there now. That person's no longer practicing there, but I've heard similar stories from other people who are when they're in Black communities, especially when they know that, a lot of Black people don't know how to report these things. They just take that information and they're like, "Oh, well, you told me so, but must be true." And that's exactly
Yeah.
what they told me I needed the dental work on my front teeth, and I told them I couldn't pay. I don't know if I can't get the dental work. I can't pay. Just lay back and let me do it. Right? So
Yeah.
I let them do it because I was obedient and I was like, "All right, well, I just let them do it,"
It wasn't that you were
thinking
obedient.
like,
You trusted the providers because they are supposed to be trustworthy people, and they took advantage. They exploited their position of power. So I want to just rephrase that so that the onus is not on you. There was nothing that you did wrong. And it's very important that, again, that we remain as educated as possible so that we can recognize when these things happen, but oftentimes we don't see it until after it's too late. Because again, you're going to a provider. This is somebody that's trusted and maybe even well liked in the community. They're supposed to know their stuff. But again, they are also people and people are flawed. Some people are, they have predatory behaviors and it's not okay. And when you
well,
were
that's
talking,
that part is a one thing I did wanna touch on that I meant to touch on. When I was at that doctor's office, there was one time where he was busy, where somebody else had to do work for him. And that person noticed that something was wrong, and I could tell in their voice, "Hey," they're asking me questions, "Hey, did your dentist do this in particular?" I'm like, "No, they did this." And, let me let me grab your doctor." They went and talked to him, came back, I'm just gonna let him finish the work. I'm just gonna do this. It's different than how I would normally do it. Just give me a couple minutes." And you could tell, but they didn't. Even though I'm telling them this information, they didn't intervene. And so it's like the crazy part of it is that they will still stand up for each other sometimes. And in those sorts of communities, when you don't have somebody, when another doctor, another medical professional notices it, I don't know how prevalent it is, but in my case, they didn't say anything.
I've seen that happen too, unfortunately. But it's important that if you are not happy with the care that you're receiving, that you move on. You shouldn't go into a space and automatically feel like I'm not valued, I'm not seen, and I'm in pain and I'm scared. Those are really good indicators just that something's not right. And if you don't like it, yeah, it's time to go. It's time to go. Oftentimes, we will sit there and grit our teeth and bear it because we think we don't have options, but I promise you, you do. There's no reason for us to sit here and suffer the way that we do. And when you were talking, it made me think about a quote from Zora Neale Hurston. She said, "If you are silent about your pain, they will kill you and say you enjoyed it." I think about that quote a little too often.
Oh, that's deep.
Just being a person that is in the medical field, being a woman, being a Black woman. So I like to sit there and say, if I'm uncomfortable, guess what? Everybody's going to be uncomfortable too. I don't like this. This hurts. Why is it like that? I might not be the most pleasant patient, right? But we're going to be on the same page about where my comfort level is. So I kind of take that mindset into a lot of spaces. I'm not going to be the only one to be made uncomfortable in this situation. I do this at hotels. I do it at restaurants.
Why is it
I
that
absolutely do
sometimes
it in the doctor's office. And if they tell me, you know what, I can't treat you, great. I didn't think you could to begin with. This whole experience was awful. I'm elite. You know what I'm saying? I've
why
been
is it
kicked out
that
of
some
nicer
doctors won't
places.
let you bring someone? So I always try and bring someone, especially if I'm going to the ER.
That's good.
I don't necessarily always bring someone to the doctors, but if I'm going to the ER, I always try and bring someone because sometimes I'm not able to communicate on my own. And I've noticed that, especially recently, ever since COVID, sometimes they're like, "Oh no, no one else can come in." That's not acceptable for me as the patient, especially if I can't communicate for myself. I'm not going to be left by myself so you can take advantage of the situation. And what I mean by taking advantage of the situation is, especially with the type of spinal issues I have, sometimes my neck spasms and it kind of looks a little bit like a bobblehead. I know everybody's seen a bobblehead on the top of a car. It looks exactly like that. And I know it seems weird to try and compare myself to that, but that's actually what it looks like. My head is going back and forth. My speech is impaired. I cannot communicate. When I say that my speech is impaired, it's coming out like I'm having some type of seizure, except I'm fully conscious and my words are slurred as if I'm ridiculously drunk. So I've been to the ER in instances where they're like, "Oh no, she's on drugs. Don't treat her." And I'm
Yeah.
in the middle of a crisis where my neck is going up and down. It's super painful. I can't sit down because they get worse. I can't stand up for too long because my legs are getting weak from all this neck movement. So I'm literally standing in a corner, holding myself up, tears just rolling. Sometimes the pain is so severe that these weird noises coming out of my body that I don't even notice I'm making. And they'll just discard me as a drug addict. And it has nothing to do with drugs. And
Yeah.
so I bring someone and they'll be like, "Oh no, they can't come back." And I'm like, "No, no, no, they have to come. I'm not going to stay to get treated without this person."
Yeah.
And even through, the miscommunication, because it takes a few times for me to try and say it, they're trying to be adamant. You can't have a guest. This is not a guest. This is my caregiver.
Something else you can do is also have that in writing and write it down and just go ahead and pass it to them so they understand that this is a habitual thing. You are coming prepared because this is what happens to you often. And it might kind of help change their perspective as opposed to you just saying it like, no, I do this all the time. This person's going to help me with my care, so on and so forth. Will it work every time? No, because sometimes people won't change their perspective. But it's one less step that you will have to do in that moment. If you come with your binder, you know what I'm saying? Here we go. This is what my medical history looks like. I need this person because of this reason. Here, just take it, you know? Anything that you can do to kind of take the pressure off of you in that moment when you're already in crisis is going to help you in the long run because you already have to keep track of so much and you're trying to advocate for yourself when you're already in a super vulnerable situation. Whatever you can do to help prepare ahead of time, I would say just do it. And it's tough to have to navigate this. And I wish you didn't. I wish it wasn't like this. But the system is broken and we're people, we make mistakes. So, whatever you can do to help safeguard yourself, please do it. I think having someone with you is a big one. You can request a chaperone if you don't have someone with you, especially if it's going to be, a more invasive exam. There should be a chaperone when you're getting a PAPS a PAP done. You know, you also have the right to request that you don't have people that are learning, right? You could go to a teaching hospital and they could say, "Oh, our resident's going to do it." You could say, "I don't want a resident." You have a right to request that. You have a right to sit there and say no, right? You have a right to everything that's in your medical record. If they tell you, well, we're going to charge you per a page, that's fine. But I have a right to that information at any given time. I think we should include that in the caption. We have a link of what your patient rights are. Because, like Jillian was saying, the more educated you are on the matter, the more prepared you'll be to advocate for yourself in these tough situations. So
And always read your
that's what,
medical records, because the doctors will tell you one thing and there will be something else on the chart. I recently found that
yeah,
out. I
yes.
actually had a heart attack at some point, and I just found out this
Didn't even know.
during this whole miscarriage thing. I was like, "Wait, what?"
Yeah.
They're like, "Because you've had a heart attack before." No, please tell me about this. When? Oh, they don't. It's a date unknown. Well, when did they find out? A couple years ago. Excuse me. So I had a heart attack a couple years ago, and nobody ever bothered to tell me.
And stuff like that unfortunately happens all the time. So if you want to make it a habit to include that in your annual stuff, okay, I get my PAPs here however so often, or I do my checks however so often. Part of that annual review is let me see what's in my chart. I need everything.
Yeah, I
Yeah,
log in all the time and take a look at what's there. I log
I
in, I
never
take a
really
look.
think about
If
it.
I
I'm like,
if
okay,
I
the
go
doctor
get
told me what it
diagnostic
is. Ha
results,
ha.
no, if I get diagnostic results, if I get any sort of lab exam, I check to see if that place has a portal. BioReference, LabCorp, Quest, all of them, even the place where I get my any sort of x-rays and stuff, there's a place in Melbourne that I go generally, they have a portal. So
Yeah.
all of those places, I go in and I look at the portal most of the time. If it's been processed, has like LabCorp, all your results have the actual result and the expected result. All of
And
your x-rays have
sometimes,
notes, all of those.
sometimes
I had a
false positives
hysterectomy on my
before.
heart. Look, when I went to go get my DNC, they were like doing my history, and they're like hysterectomy. I'm like, I wouldn't be getting this DNC if I had one. And he
Yeah.
laughed, and then he said, "You're right. Why is it on here?" I was like, "I don't know. I didn't put
Yeah.
it there."
Crazy. Yeah. Last time I went to the doctor, they went to go look at my medical records and they were like, "Well, you just got your labs done yesterday." I was like, "I did not."
I don't
And
know
then
whose
finally
labs those are, but
I'm
they
like,
aren't mine.
"No, I did not." And they looked and they finally like actually going over the documentation that had been associated with my chart. They're like, "Mondesir, right?" My entire life.
Yeah.
uh Hold on, that's not your first name. That's your birth date, but you're not in Pennsylvania.
Yeah. These
Yes.
things, they
That's
happen.
100% correct. I
Ask
am not in Pennsylvania and my first
questions.
name is Jessica. So,
Yes, ask questions. If something doesn't
yeah.
seem right, there's a good chance that it isn't, and maybe you have to go be seen by someone else. Yeah, listen to your instincts.
We talked about basically making sure that you are having good communication with your doctors, making sure that you are paying attention to not just your own medical history, having that conversation that is more of a teamwork with your doctor, making sure that you are aware of the care that you are being provided, making sure that you are speaking up when something is not right, because we generally know when something's not right, but sometimes we just allow it to happen thinking that you have no other choice, but you do. Um, Making sure that you understand that every state has a medical board. So if you have care that you are concerned about, that you have been mistreated, that something has happened, please make sure you are contacting the medical board for your state. We also talked about the specifics of when we're getting down the weeds with the care, and our doctors are talking to each other, and how that works, and both medical professionals that are on was able to give us a bit of insight into how that works, and why it's segregated, why it looks the way it does from a patient standpoint versus from the medical professional standpoint. Thank you so much, Jillian, for coming on.
Do you have any final thoughts?
What I would say is just remember to be your best advocate. You are your best advocate. Don't let anybody tell you that you're okay when you don't feel that way.